So this is a patient who's had PAH from Coolsculpting from 9 months ago. So you can see she had a large applicator right up here. It's softer than, it was firm at first and now it's softened up. So we're gonna do liposuction and flip to the other side if you can. So you can see it pretty prominent as she stands to the side.
Here we are performing local anesthesia, which is safer than general anesthesia. Tumescent anesthesia allows contraction of blood vessels, so there's minimal loss of blood and much quicker recovery for the patient. The cannula is infiltrated underneath the skin and pumps the fluid into the area. This patient is awake and comfortable while watching one of her favorite movies on Netflix while this is being performed.
You got the video on?
Yeah, I turned it on now.
So this is the fat coming out. Usually fat's a little yellower in color, but everybody has some variation. But we are getting some good return here. Should be good there. All right, face me. This is the area we treated. We got a lot of fatty tissue out. It was a little fibrous, not as much as I expected. We blended it into the lower abdomen here, which we didn't treat. So her issue was just one single applicator about the size of my hand that was done with Coolsculpting. So I got that area plus more surrounding tissue. This is a little fluid, water fluid. We've already checked it. That will drain out on its own. Let's turn you this way a little bit. There she is from the side. And you can see the amount of fatty tissue we suctioned out. It's fibrous, so that tends to be a little bit red instead of yellow, but it's still fatty tissue. And it looks like we have probably about 350 to 400 cc's of fat, and which is good. One Coolsculpting applicator does 40 cc's of fat, so if this is 350 cc's, that's about 9 applications of Coolsculpting.
We will now look at her 2-week after photos, which will show the hyperplasia area has been greatly reduced. You will see from the front and side profiles. This patient had a previous abdominal surgery years ago with pre-existing stretch marks, which now may appear higher. They are the same stretch marks. As you can see, they are still about 3 inches above her navel. But the PAH caused her skin to expand similar to the way skin expanders are used in plastic surgery. Once it contracted, it's much flatter with good retraction.